So I would start once I can see more faces. Great to see. So quickly type down in the chat box, are you excited for today's session to know about Omicron and how we are going to come out of all the fear we have, all the precautions we need to take and everything. Great, great, great. So being worried about your pregnancy due to this third wave of COVID is quite obvious. We present you this workshop, this wonderful workshop to clear all your doubts which you have and learn symptoms, cure for the COVID of this third wave, precautions to be taken. And all the questions will be answered by none other than Dr. Narendra ji today. I welcome Dr. Narendra. Dr. Narendra ji, are you there? A very, very warm welcome to you as well.
Thank you, Yukti. Thank you. I'm right here.
Great, great. I'm just giving you spotlight, sir, so that you can address all of us. Yes. Just a second. Yes. Can you all see Dr. Narendra ji? Yes, I can. They can see. Yes. Very warm welcome, sir. Take over the session, please, please.
Namaste. Good morning. A very, very warm welcome on this very cold North Indian Sunday morning. We are shivering here. I'm from Agra and I'm talking from here. Agra is actually cooler than Shimla and Kullu today. So it is very overcast, very foggy and very cold. And the cold weather and the hot weather has shown us that this coronavirus is not affected by weather. So it is prevalent all over the world, even in the coldest period. So let's go back and understand what happened. On 17th of November 2019, in Wuhan, in a live animal market, someone got infected by eating raw bats, by eating meat, or it was probably a scientist from a Wuhan lab who walked there and he sat and ate his food, and then he developed this disease. And this disease that time was severe cough, breathlessness, and could not breathe, and oxygen saturation, and he finally died of this disease. So this disease that time was called as COVID-19 because 2019, and COVID because it was caused by coronavirus, CO, V is virus, and VI is virus, and D is disease. So COVID-19 was given. Then the WHO said that we cannot blame year for the disease. So they renamed the disease as SARS-CoV-2. In India, this disease came in January 2020, around, I think, 20th of January, first case was noted in Kerala and Delhi, and then it spread. So coronavirus is known to us since a very long time. Common cold virus और ये सब है, वो corona family होता है. And it is said maybe it was till we are very sure. So this coronavirus jumped from the animals and to the human beings. Are you getting my sound okay now? Because someone is saying that sound is not coming.
Yeah, a bit of a network issue, sir, at your end. Your voice is cracking.
So let me just shift to a different network in 1 minute. I'll do that.
Yes, sure.
And we already see that we have a lot of questions, which is very, very good, that so many people are interested to know more about this dreadful disease and this dreadful. So just a sec. Yeah, okay, now I'm clear. Now it is clear.
I think it's better.
So then this COVID-19 attacked us all from 2020, and we had a first wave of the SARS. SARS is acute respiratory distress syndrome. And this disease was also caused by influenza and all long time back. And then it spread all over the world and became a pandemic. Pandemic means every country in the world was reporting cases. And then a lot of patients succumbed to the disease, and they had very serious illness and had to be admitted. Then we developed, of course, some medicines and everything. So this virus is very smart, and the virus human being war is going on since a very, very long time. So viruses are smarter than us. They change. So once we develop a disease or a vaccine, they change their shape. They change this. What you see behind me, you see those spikes on the virus. They change the spikes. So the disease, the medicine does not get effective and the vaccine does not. So we have to change the vaccine, change the medicine. So these are known as variants. And then in 2021, we got a deadly variant called Delta variant. And this Delta variant affected so many people, and in pregnancy and the older, and so many people died world over. And that dreadful pictures are still in our. So then came the vaccine, which was a breakthrough in 2021. And once we started vaccination, the Delta variant seriousness got less. And when the seriousness got less, the virus, the smart virus changed again. And in November 2021, on exactly 24th November, the WHO announced that a new variant has come, which was called as B1.1.1529. And this was reported from Botswana, South Africa. And then finally, WHO renamed it as coronavirus, Omicron variant. And they said this is a variant of concern, or it is a VOC. So the Delta reduced and the Omicron, and it was seen the Omicron is very fast in spreading. So from November 2021 till now, Omicron has spread all over the world and is attacking us. And we are right in the middle of the third wave. We are about to peak in India. Next week, we'll have the maximum cases. And then probably this will very soon vanish away, and we will get, we'll be corona-free, hopefully by April, unless a different variant comes. Now, two different variants have already come, which is known as Flucron. That means your flu virus and the coronavirus have joined hands against human beings and made a combined virus, which is called as Flucron. And the Delta, which was dying, the Delta variant, and the Omicron variant also have made friends with each other, and they have come out with a new variant called as the Deltacron. So how deadly the Deltacron and Flucron will be, we will know in the coming period of time. But it is estimated that this disease is now going to reduce from April onwards, and it will remain as endemic. It will remain with us forever because corona attacks will come. So women who are not vaccinated, please immediately get your vaccination done. Whatever vaccine is available. India has now started third dose. India has started for children over 16. So get everyone vaccinated by Covishield or Covaxin or Sputnik or the other new one. What we are waiting very eagerly is for the nasal vaccine by India, which will come probably, it had to come by December, but it will take another 3-4 months. And the nasal vaccine, when we put the drops in the nose, would be probably the best because it will protect the attack of the virus in the nose. Otherwise, the vaccine works by improving your army to fight the virus in your blood. So the vaccine goes in, starts the immune response, and then you get immune responses, and then your immunity develops. So it does not prevent attack. Attack is from the nose and the throat. So vaccination people will get breakthrough infections, and these are known as breakthrough infections in the nose, but the infection will be mild and no hospitalization will be required. All vaccinations are effective against Omicron, despite of the many reports that this vaccine is better, that vaccine is better. All vaccines do help in preventing serious illness and hospitalization and death. So vaccination is very, very important. And what is other important is masking. Do not move out of your house till the third wave passes, and repeatedly sanitize your hands. Keep a sanitizer available, sanitize your hands, and keep washing your hands repeatedly. That is the only way you can be safe from COVID. The symptoms of Omicron are same. I'll finish off briefly and then there are lots of questions. So we'll take one. Symptoms are same. You start with cough, you get fever, you get tiredness and extreme fatigue. You get headache, especially behind the eyes. You get dyspnea, a breathing problem, very sore throat, because Omicron attacks and our throat has the maximum immune cells to protect us from diseases going through our breath. So this virus sticks here and does not go into the chest. Unlike Delta virus was going into the chest and attacking the chest and causing oxygen saturation to fall. This virus sticks in the throat, so it causes very severe throat disease. Then you can get diarrhea, you can get nausea and vomiting, you can get loss of smell and loss of taste, and you can also get chills and rigor, thanda hoke bukhar aana, that also is possible, and you can get that. So the symptoms are nearly same. Now the problem is, in this month we get same symptoms by common cold. So it is very difficult sometimes to differentiate between common cold and this. For that, if the symptoms are increasing, monitor your symptoms, monitor your temperature, monitor your oxygen, and you can get yourself tested. Now home tests are available, antigen tests, which are about 75% accurate. So if the home test comes positive, you can do it in 10 minutes. Then you need to take some medicines and isolate yourself for 10 days. If the home test is negative and your symptoms are increasing, then you have to get the NAT or the RT-PCR test for confirmation. And if your fever does not come down, or if your oxygen saturation falls, then you need to go to the hospital and consult. Otherwise, you can do teleconsultation and take home treatment and isolate. How do we prevent from this disease? Of course, by masking, by sanitizing, and keeping away from people who have the disease. And then regular exercises, meditation, yoga, immunity boosting exercises, which are very important. Your body relaxes, so your body will improve the immunity. Drinking all the haldi will burn you inside. So mildly drinking that. Then immunity booster vitamins, zinc, vitamin D, vitamin C, folic acid, B complex, drinking a lot of water, hydration, taking a very balanced, good, nutritious diet, and of course, being a part of the COVID help groups so everyone can discuss. Now in pregnancy, when this occurs, it becomes serious disease sometimes. With the Delta variant, the pregnancy was very seriously affected to the mother, and the babies were delivering premature and even dying inside. But rarely this virus crosses the placenta and goes to the baby, very rare. So vertical transmission is not there. It will not affect the baby if you are testing positive and not seriously ill. So don't be worried about that. Mild disease will not affect your baby. And even the medicines which you take for mild disease will not affect your baby. So be safe in pregnancy is what. Now there are many medicines which have come. Of course, general medicine like antibiotics, Montor LC, Vicodil tablet, throat syrups, lozenges, steam inhalation, gargles, all that can be tried. There are specific drugs now available for coronavirus by Cipla company, which about 40 drugs have to be taken, 40 tablets in 5-day course. Mild disease, they do help. Now there's become a fashion to take monoclonal antibody injections. Now antibody, as the name suggests, is antivirus. Your body will produce antibody to all diseases. That is why we get vaccination. So antibody injection is expensive. There are two types of them. Both have to be mixed and taken half-half in early disease. They do prevent serious disease, but they have not yet been shown to be very effective against Omicron. So just taking 1 lakh rupees of antibody injection is a fad these days. Only if your doctor thinks you're getting serious, you need to take it within first 5 days of antiviral treatment. Yes. A little bit about vaccine, and then we take your question. Vaccine, you have to take vaccination, very essential. There are two common vaccines which are available in India, Covaxin and Covishield. Covaxin is taken at the interval of 4 weeks. Covishield is taken at the interval of 6 to 12 weeks because it builds up antibodies slowly. And a booster has to be taken after 6 months, the third or the precautionary dose. Some countries like Israel have already started giving the 4th dose. Now you can take vaccine very, very safely in pregnancy, whatever the term of pregnancy. First month, second month, third month. Vaccination has to be taken whenever you are pregnant. And everyone who is eligible for vaccination should get vaccination. Very, very important to take vaccination. It will prevent serious diseases. And as I told you, when we get the nasal vaccine, by next year, the 4th dose probably we all will take as the nasal drops. So now, Yukti, let's take the questions. You can read out the questions to me, or you can ask people to ask them. This is briefly about COVID, Corona, and Omicron, which I have told you.
Yes. So we can take some of the questions which are in the chat box, and then we can take by unmuting them so that all of them are covered. So the first question is from Prachi. She's saying, during pregnancy, if we have common cough and cold, what kind of medicine should we take?
So common cough and cold, as I told you, is very common in this weather. And common cough and cold will not give you fever, not give you very much severe headache or body aches. But it is very difficult to differentiate from COVID, the Omicron, mild Omicron. So get yourself tested. If you're Omicron negative, then maybe a mild antibiotic like azithromycin, some throat lozenges, and some cough syrup will work. What you gharelu nuska, what you take home medicine treatment for all these diseases.
Next question is from Kanchan, doctor. She's saying, I'm pregnant and living with a COVID positive person. How to deal with that?
So either you lock yourself in another room or lock him in another room. So you have to separate for 10 days. Separate for 10 days till they become COVID negative. They still might be test COVID positive after 10 days. But after 10 days, usually infectiveness is less when you get mild disease, especially Omicron.
Good. Rais is asking, I'm fifth month of pregnancy. Can I take medicines related to cough fever? And I have pain in shoulder and also stretch marks and all.
So in pregnancy, paracetamol is the safest drug. You can take that. Anti-allergic like Allerga, if the cough is Allerga, Montor, LC, Vicodil, these are safe in pregnancy and they can be taken. Cough syrups are safe and can be taken, especially honey-based cough syrups like Honitus, etc. The Davar cough syrup, that all can be taken. And warm saline gargles or betadine gargles are the best.
So Saloni is asking, a lot of questions are quite similar. So I might skip some similar questions. Saloni is asking, I am a lactating mother and have received my third dose. How effective is it in preventing Delta or Omicron to develop and transfer to my infant?
So when you develop antibodies, the antibodies go through, the antibodies cross in pregnancy and go to your child if you're unborn and pregnant. And through breast milk also we get a little bit of antibodies. But it is usually seen that very young children are already immune protected against this virus. And very rarely children get virus, especially Delta. Omicron is affecting children, but not that much as it affects the adulthood. So yes, your third dose will send some antibodies through your breast milk to the child. But still precautions of masking. If you get the disease, masking has to be taken.
Next question is from Khushbu, doctor. She's saying, I am 25th week of pregnancy and wish to know when would be the right time to travel long distance from my workplace to maternal home for delivery as COVID is increasing. Till what week it would be safe to travel?
So usually travel in pregnancy can take place till 32 weeks. After 32, it is a little bit risky because you get a chance of preterm delivery. So you can go at 32 weeks, your 9th month starts. And as the old mother tales go, 8th month mein travel nahi karna hai. So probably that holds truth, a little bit of truth, though it is a big myth. But you can travel, could be anytime, but probably at 32 weeks.
So there's a situation which Poonam is sharing. She's saying, I'm 38 week, 5 days pregnant. My doctor planned for cesarean section delivery for Monday, that is tomorrow. Yesterday evening, I tested COVID positive. I'm really worried. What to do, please suggest.
So you will have to now, because you are 38 weeks, 6 days elective cesarean will have to be done if you are not very seriously ill. If you're getting high fever and all, then maybe 2-3 days it can be postponed. And of course, you must take the treatment, especially for you. Monoclonal antibody injection would be a good idea to take because it will protect the baby also. And the doctors will also have to take precaution by PPE kits and all. So don't get worried. The disease is usually mild and usually will pass off in 5 days. But if you're getting high fever, then the doctor will herself defer from the Caesar for 3 days.
I think that answers our question. Next question I'm taking, and then we'll take questions from the users by unmuting them. Akhila is asking, if a mother is tested positive at the time of delivery, will she be allowed to breastfeed her baby post-delivery? Is there any possibility of spreading infection to baby via breastfeed?
So the virus does not go through breast milk. So breast milk is safe, but feeding is difficult. So you have to feed with the full mask on and full mask and face shield, and you turn on the other side so you are not breathing on the baby. So that transmission can happen, but from the milk, there's no. So if you are very seriously ill, then the breast milk extraction can be done by breast pumps, and you can probably feed that with the bottle. So yes, you can breastfeed, but with care.
Great. So should I unmute and can let them ask question, Dr. Anil?
Yes. Why not?
So Anila, you can ask your question.
Good afternoon, doctor. Hello.
Yeah.
Yes, you're audible, Anila.
Yeah, sir, actually, I was tested positive last Wednesday, and I had developed little symptoms since last Sunday, and that was like headache and a bit body ache. So I got myself tested on Wednesday, and it turned out to be positive. So I'm at home. I'm in self quarantine. So there is no such as such. I'm not taking any medicines. I just took one paracetamol only and taking steams and all. So now I'm feeling much better. So can I take the test again tomorrow?
So testing again is not required now, and by all WHO, Indian government, ICMR, they said no need for repeat test. 7 to 10 days quarantine is enough. You are negative, you're not going to spread. The test may come positive even because the dead virus might be there. So this test picks up dead or live virus. So obviously after 10 days, there'll be no live virus. Your body has fought it off well. So if you want psychologically to test and say that I'm negative, you can go ahead. But if your test comes positive, don't worry. You can still go. You're still
Sir,
safe.
okay, sir. One more thing. Can I join back office next week if I'm
Yes, you
test
can.
negative?
Yes, 10 days. 10 days is quarantine. After 10 days, you go to work.
Thank you, sir. Thank you very much.
Okay. So Mehak, you can ask your question, please.
Yeah, thank you so much. And sir, thank you so much for this wonderful session. It's really helpful. Actually, my question is that I'm 12th week is running right now, and I was tested positive last Tuesday. So my NTNB scan is due, like it was due on 15th. But my doctor is saying that again, like you get yourself tested, and then only we can proceed for NTNB scan. So, means can I do it from the home kit? First question.
Yes, you can do your home kit, and it's 75% of it. It is. If it is still positive, then it is dead virus. As I told you, 10 days have happened. You're not. You can tell your doctor that after 10 days, infectivity is not there, and please do my NT-NB scan. They can take precautions. They can put the mask because NT-NB scan before 13 weeks, 6 days is very essential. We cannot delay that.
Okay. Like how much time? 13
13
weeks.
weeks, 6 days.
13 weeks, 6 days means within that we have to get it done.
Yes. Before
Okay.
14th weeks.
Before 14th. Okay. So, and one thing more, sir. Actually, मैंने medicine लिया था. अभी Zagdi मेरे डॉक्टर ने प्रेफर किया था. तो उन्होंने बोला कि अभी आप उसको 1 week और continue रखिए. But मेरा throat is like quite sore. So उसके लिए what can I do?
So throat के लिए gargles, steam inhalation, lozenges, strepsil, honey tuss, Alex, whichever lozenges, phyto relief, whichever 3-4 times, and you can take any of the anti-allergic Montor, LC, Vicodil 3 times a day for 2-3 days. Throat will remain bad for at least 7 more days.
Okay. And sir, I took my second dose in December. So, like, is it good to take the booster dose? When can I take it?
This December, 1 month back?
Yes, December.
6 months. So June will be your third dose.
Okay. So means after delivery also we should get the booster dose done?
Yes. Now you got the disease, so your third dose is already the disease.
Okay.
So this must have increased your immunity many times more. So if you want to be very sure, after delivery you get your antibody test, and if your immunity is very high, no need for third dose.
Okay. So like third dose, अगर immunity weak रहता है तो लेना जरूरी है.
जिसको disease हो गया 2 vaccine के बाद, the third time the disease is like the third dose.
Okay. So that means I should take the booster dose after delivery also.
6 months.
6 months. 6 months gap is required, right? Second and third dose.
Yeah.
Okay. Fine, sir. Thank you so much.
Great. I think that was an helpful advice to make.
Yeah.
Next question. Kanchan, if you have the question, you can please ask it by unmuting yourself.
Yes, thank you. Good afternoon, doctor. Thank you for the information. I wanted to understand, I also have a situation. So I detected my pregnancy very early on. So initially the doctor that I was consulting, she advised against taking the second dose. She said, now you're pregnant, you can't take the second dose of the vaccine. After that, we had to shift and the doctor changed, and now the doctor is advising that you should definitely go ahead and take the second dose. But then one of our family doctors is advising against it. So I'm like really confused. One is saying you should take the vaccine in pregnancy, and the other doctor is saying you should not take that risk. So I am really confused. I don't know what to do.
So vaccination has to be taken. There is no doubts in pregnancy, second, and even those who are eligible for third dose. It is unfortunate that some of our doctors are scared of this vaccination. This is known as vaccination hesitancy. And we are trying to tell all our doctors, please do not advise against vaccination, even in pregnancy, even in old age, even those who are heart disease, even in diabetic, even in kidney disease, any disease, anything, vaccination is a must. So vaccination has to be taken. Government is saying it, WHO is saying it, all the good doctors are saying it. Some doctors are scared for whatever reason. They have to be educated on letting everyone take the vaccination. Vaccination is absolutely must.
So I've just started with my 7th month. It's fine, right? It's not going to impact the baby or something.
It will help the baby. It will pass on the antibody to the baby.
All right, great. Then I'll get it done. Thank you so much, doctor.
Get it done tomorrow only.
Yes, I'll do it. Thank you.
Great, Kanchan. Next question is from Bhakti, I think. Bhakti, you can ask the question.
Hi, doctor. Thank you for the session. So, day before yesterday, I was having a bad throat. And yesterday, I was having a really, really bad headache and severe lower back pain and body ache. So, I thought it can be acidity because I have acidity issues. Then I took Pan D. I vomited thrice. And Raat ko I checked my temperature. It was 99.2. But then later, I took Dolo 650. Today, the pain is not, the body ache is not there, but headache is very severe. So what would you suggest, doctor?
So mostly you will turn out to be COVID positive. These are all COVID symptoms. Isolate yourself for 7 days and take a mild antibiotic, azithromycin, take throat tablets, Montor LC 3 times a day, take steam inhalation, gargles, and all around you, and lots of vitamin D and vitamin C and your vitamins, and just meditate and be calm.
So shall I use the home test?
Home test, so anybody who's having cough and cold should do it immediately.
Okay.
Though a negative home test does not guarantee you don't have. A positive home test will tell you positively have, a negative home test and the symptoms increasing, then you have to get RT-PCR.
Okay, so I'll do that today. Yeah. Okay,
Do
doctor.
that.
Yeah. Thank you so much.
Okay.
Yeah.
Thank you, Duti. Achal, you can ask a question.
Hello, doctor. So my husband had fever for 1 day and we got the RT-PCR test done. It came as negative, but the doctor that we consulted, he still said that to treat it as positive and isolate yourself. So I wanted to know, is RT-PCR not reliable anymore, or?
So home test is reliable 75%, RT-PCR is reliable 90%.
Okay.
10% RT-PCR still, when they're negative, COVID could be there. So, and it could be in the incubation period. So the virus has not picked up or not done properly. So repeat the RT-PCR.
So how many days should we isolate in that case?
7 days.
7 days.
Yeah.
Okay. Thank you, doctor.
So a few more questions I'll pick from the chat, and then again we'll take questions by unmuting yourself. So Saba Islami is asking doctor that my husband is COVID positive and he is admitted in hospital, but my test is negative and I don't have any specific symptoms. I'm 8 weeks pregnant. Anything can help me to stay more healthy, and what if I come positive? Do we need to meet any gynecologist?
So take your vitamins, do meditation, do regular breathing exercises, do mouth gargles, and keep hygienic, keep on washing hands. In your house, sometimes this virus, when you cough and all, can stay on the table and all for 6 to 8 hours. So get everything sanitized properly, and wish you all the best for your husband to be back soon. Once he's negative and back, then there's no problem. By the way, if you get symptoms, and if you are vaccinated, there'll be mild symptoms. So just take mild medicines like Dolo and Vicodin and azithromycin and inhalation, and you will not require anything else. But if you're not vaccinated, please take your vaccine.
I think that was a helpful advice. Next question is from Rinki Kaushik. She's asking, doctor, I'm 35 weeks and 4 days pregnant now. I was COVID positive 1 month before I conceived. So I couldn't take vaccination as I was also taking ATT, that is anti-tuberculosis treatment. Am I at high risk now?
So anyone who has any other disease is high risk, and anyone who is pregnant is high risk. So take your vaccine immediately.
I think, Rinki, that will help you out. Avirupa Datta is asking, I've taken my second Covishield dose on 16th June 2020. Should I take the booster dose now?
Yes, you are eligible for the booster, the third dose, and just enter into the Covert app, and they will tell you which date to take.
Okay. So I think anybody can get vaccinated irrespective of in which trimester they are, doctor?
Irrespective. First trimester, second trimester, third trimester, vaccine is very, very safe. Only thing is you get a little bit of fever and body ache with the vaccine, which can be taken care of paracetamol tablets and taking a rest. That's it.
I think that answers a lot of questions. You can take your vaccination in whichever trimester you are. Praneeth, you can ask your question, please.
Yeah. So I'm at a high risk of preeclampsia, and I'm already on heparin and ecosprin also. Do I need to change my medicines or stop my medicines for a time?
No, heparin and aspirin will go on continuously till 9th month. Aspirin will be stopped a few days before your delivery, a week or so. Heparin will be stopped only 1 or 2 days before, and after your delivery also, after 48 hours, maybe the heparin will have to be restarted for another week or 10 days. So that is how heparin and aspirin are good, and good for COVID, because COVID causes clotting. So these two will prevent serious disease. So it's good. Keep on continuing.
So with these medicines, I can take my vaccinations.
Absolutely, yes. Bilkul.
Thank you so much, sir.
So someone is asking, hospital, should we visit frequently? Well, your antenatal visits have to be done. They're reduced. You can try and do teleconsultation hospital visits where, hello?
Yes, we can hear you, doctor.
So teleconsultation hospital visit, you can take your weight and your blood pressure at home by your machines. There are small fetal heart measuring Dopplers, which you can put on your tummy and get the tip, 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 and record that and send it to the doctors. That is how we were doing in March, April last year when COVID was very, very bad. But right now, COVID is very mild, though it is, you have a risk of catching Omicron. So try to avoid, but if it is crucial visit like your NTNB scan, your anomaly scan, or your vaccination date, please go with care. N95 mask.
Okay. Rice, you can ask your question, please.
Hello, sir.
Yes.
आई एम 20th वीक प्रेग्नेंट, तो मेरा ना लास्ट कुछ वीक से बहुत तबीयत खराब हो गया, कोल्ड वगैरह हो गया था, तो मैंने अपनी डॉक्टर से कंसल्ट किया, तो उन्होंने मुझे मॉन्टेर एलसी, एजिथ्रोमाइसिन, हनीटस, डोलो ये सब रिकमेंड किया था लेने के लिए। तो अभी बहुत टाइम हो गया, मतलब बहुत सारे वीक निकल गए, लेकिन अभी भी मेरी जो थ्रॉट प्रॉब्लम, कफ प्रॉब्लम, कोल्ड और फीवर भी होता है बीच बीच में। अभी तो मेरा ये बॉडी एक स्टार्ट हो गया है, मतलब बैक पेन, लेग पेन, शोल्डर पेन। तो व्हाट शुड आई डू?
सो कोविड टेस्ट किया था आपने?
नहीं, अभी तो नहीं किया कोविड टेस्ट।
एक तो कोविड टेस्ट कर लीजिए, अगर कोविड टेस्ट है, परसिस्टेंट कोविड इन्फेक्शन आ रहा है, तो फिर थोड़ा सा स्ट्रॉन्गर मेडिसिन देंगे। अदरवाइज एज आई टोल्ड यू, सोर थ्रोट और कॉफ पोस्ट कोविड सिंड्रोम कहते हैं इसको, कभी कभी एक महीने तक लास्ट कर रहा है। सो सेलाइन गार्गल्स, वार्म सेलाइन गार्गल्स, बीटाडीन गार्गल्स एंड कंटिन्यूसली फाइटो रिलीफ या हल्दी की टैबलेट मुंह में या मुलेठी मुंह में चूसना, ये कीप ऑन डूइंग दैट अगर कोविड नेगेटिव आते हो तो। बाकी एंटीबायोटिक, मोर एंटीबायोटिक इज नॉट रिक्वायर्ड।
ये जो एंटीबायोटिक मैं ले चुकी हूँ, क्या ये मैं दोबारा रिपीट कर सकती हूँ? जैसे मॉन्टेर एलसी, एजिथ्रोमाइसिन,
मॉन्टेर एलसी एलर्जी के लिए होता है, कॉफ के लिए, थ्रोट के लिए। एजिथ्रोमाइसिन एंटीबायोटिक है। एजिथ्रोमाइसिन का अगर फीवर आ रहा है, देन यू कैन रिपीट अ कोर्स फॉर 3 or 5 days, बट मॉन्टेर एलसी आप ले सकते हो।
जी सर, लेकिन अभी मेरे हस्बैंड भी मेरे साथ हैं इस टाइम में, उनको तो कुछ नहीं हुआ। अगर कोविड का कुछ सिम्टम होता है या ऐसा कुछ?
मोस्टली कॉमन कोल्ड है ये, आपको मोस्टली ये सर्दी वाला कोल्ड है। सर्दी वाला कोल्ड कभी कभी 1 महीने तक चलता है। को विक्स नमक के पानी, हल्दी वाला दूध, थोड़ा बहुत काढ़ा, ऐसी चीजें लीजिए, लोकल चीजें।
सर ये बैक एक का बहुत प्रॉब्लम हो गया है, मतलब शोल्डर और नेक में बहुत पेन हो रहा है, और बैक एक होता है, लेग पेन होता है, तो ज्यादा मतलब फैटीग हो रहा है बहुत ज्यादा। इसके लिए आप मुझे कुछ बताओ।
सो एक तो कोविड टेस्ट कराना, बिकॉज ये सब कोविड के सिम्टम्स हैं। अदरवाइज बैकएक, कैल्शियम और विटामिन डी डेफिशिएंसी आल्सो कॉजेज बैकएक, so be sure your increase your calcium and vitamin D intake, and any pain oil or relaxel ointment बैक में और शोल्डर पे रब के लिए वो करिए हल्के हाथ से।
ओके सर, थैंक यू सो मच।
Thank you, Rice. Should I take more questions, Dr. Narendra, or you have something to say?
No, what I have to say is that we have to be very, very careful. A good diet, good precautions are very important. This disease will stay with human beings forever now, though it will not come in waves, but कभी न खांसी जुकाम होएगा तो ये होता रहेगा। और सिर्फ what we can save ourselves from the disease is sanitization, repeated hand wash, hygiene, good diet, good vitamins, supplements. Improve your immunity by meditation, yoga, exercise. iMum's app takes you to all the yoga and exercises and meditations. Do all those. Bring positive thoughts in your head. So always think positive. I am strong. I can fight COVID. Your COVID cannot attack me. Corona will be always stay away. Positive affirmations are very, very important, along with medical interventions. Medical interventions, the disease, the medicines are coming. We now have the first medicines against coronavirus. We will very soon have many more medicines. So जब भी ये COVID होएगा तो medicine आ गई है, और we will take that. And many other vaccines are also coming, even better vaccines. But जब तक नहीं आती, whatever vaccine is available, please vaccinate yourself. That is very, very important.
Vaccination is very important. All of you must take that. Next question I will take up from Vedru Parthi. Shelja, you can ask your question, please.
Yeah, so hi doctor. So I am like 12th week pregnant, and day before yesterday I got a full high fever, and yesterday so I tested and it was positive. So today my fever got control, and like, but the thing is like my throat pain is there, and like in throat it's like very irritating, and cold is there, and like I'm getting cough, which is like usually when we get fever and cold we'll get a cough with like this phlegm and all, right? So such kind of cough I'm getting. So like, is that something which I need to consider this cough, or like I can just ignore? Like I'm taking dolo and like Destol, some another tablet, and along with that I'm taking all home remedies. And for nasal irritation, like the dryness, I am taking this saline nasal solution drops into my nose.
So you're taking the right thing. You can add a cough syrup to it. Any cough syrup, Ascorel, Corex, Hanitas, and you can add Montor LC 3 times a day for your throat irritation. And these two can be taken for 5 to 7 days till your infective period is gone. But sore throat will remain for a month. So for that, Alex lozenges or strepsils and gargles are the very important thing.
So actually, after I got pregnancy, I got this thyroid as well in the pregnancy. So usually before that also, I used to have that kind of irritation in my throat daily, morning times like that.
So those are allergic. Some people are allergic to some things, and they have repeated when the weather changes. They have a lot of throat soreness. That is different. But this, since you have tested COVID positive, you better take the COVID treatment for 5 to 7 days and isolate yourself for 10 days because you're positive. And the throat will, home remedies, muleti, take in your mouth, strepsils in your mouth, throat infect, this thing, steam, all that can be.
Okay, thanks.
Yeah, Gauri, you can ask your question.
Hello, doctor.
Hello.
I'm 35 week pregnant, and as a precautionary measure, can I take Limsi and Zincovit? Is it advisable?
Absolutely, yes. When you take the iron calcium combination and a multivitamin combination, most of them have zinc and vitamin C and vitamin D. If they don't have, if it is pure iron calcium, add another tablet like ZAC-D, a woman, or any Zincovit or anything which has vitamin and Limsi. Absolutely, yes. Please take them.
And how many days we should take these tablets?
These are just vitamin supplements. You can take them forever.
Okay. And like this Zincovit, we can take twice a day, or just once we should take?
Once is enough. The dose is only once.
Okay. And steaming every day is fine, right?
Yeah, steaming is no problem. But be careful, then don't over steam yourself, because steam can burn and insides and you don't feel the burn, but later it can cause problem. So not over steaming.
And booster dose after delivery is fine, right? Means it will come after. Okay.
Yes, 6 months after your last dose.
Okay, yeah. Thank you, doctor.
So a lot of questions are there. A bit of them are repetitive as well, but yeah, we'll take them as well. So I'm sharing a link right now. So if you can all take out 1 minute and review iMum's application. If you have already reviewed it, that's great. But if you have not, then you can just review it. This is going to be super helpful for our team, and we'll keep coming with super good sessions for you, which is coming up as a help to you. I hope the link is there in the chat, and you can please review us. And it will be very helpful. So I'll take next question from Trishala. You can ask your question. Trishala,
there is a question about mask. The safest mask is N95 or a 5-layer. If you're using this cloth type of mask, the 5-layer mask, and it should be very tightly fit on your nose. So you have to wear it very tightly. If it is worn like this is wrong, this is wrong, this is preventing, this is wrong, loose is wrong. And if you're while talking, you're just putting the mask down and up, it is very, very wrong. So because this virus is in your nose and in your throat, so when you talk, the droplets of your spit goes out and they can go to up to 6 to 8 feet. And the person standing 6 to 8 feet away can get infected. So the mask has to be very, very, and not the ones which have a ventilator here, because that will also cause the virus to go out and come in.
Yeah, hello.
Yes, Trisha.
Hello. Yeah, hello. This is Trishala. I'm in
Yeah,
my
Trisha.
9th month of pregnancy, and my husband got tested positive, and he has symptoms of cold body pains and all. But I have no symptoms, and he has been isolated. And don't know why from 4 days of from 4 to 5 days I'm experiencing more baby movements than ever before. Is this normal or?
So baby movements, if minimum 10, but up to 20, 30 times you can feel them. If you are, that means your baby is active and nice. And because of your anxiety, maybe the baby is also getting anxious and kicking you more. Or maybe it wants to come out a little early. So, so don't worry about it. Just take your diet. Don't fast. Even in fasting, the baby movements go fast. Or if you eat too much, also the baby gets too much energy. So it's mostly anxiety related. Your checkup must be due. Go for a checkup. The doctor will do a non-stressed fetal heart monitoring and movement monitoring test can be done, NST, and that will tell everything is normal. So don't worry. A little bit more movements do occur sometimes.
Okay, thank you.
Thank you, Trishala. Keithana, you can ask your question, please.
Good afternoon, sir.
Good afternoon.
My wife has some allergic infection. Some like whenever she ate something like cold items, she feels very cold and she sneezes like anything. Every minute, at least twice or thrice, she will be sneezing. It will affect pregnancy. She is 6 weeks pregnant.
So she must be having this from before. So that
Yes,
means she has some allergic disease. And now we have a blood test which can tell you what your wife is allergic, what all to allergic to. So this blood test can test food articles in the air, common articles and test. And if you can find out what thing is she is allergic, try to avoid that. And that test can tell you about allergy. Otherwise, a lot of us have allergies to various things, and we just have to find out what we are allergic to and avoid that. During the sneezing and all, she can take any anti-allergic, Allegra, Cetirizine, Montor LC, Betalanm, whatever drug, and that will to control immediately. But you have to find out what she is allergic to.
Okay, sir. Sir, and one more thing.
I hope the allergy does not come out to the husband.
I don't have, sir. Thank you. Sir, from yesterday onwards, she's feeling fever and chilling, chills and some body pains, sir. I don't know whether
get a COVID test done. These are symptoms of COVID.
Yeah, today I went for RT-PCR test, sir. If it comes positive, then we should follow the COVID, whatever you have mentioned.
Yes.
If
then
it is negative,
isolate azithromycin, Montor LC, steam inhalation, gargles, cough syrup, all that to be followed for 5 to 7 days.
Okay. Thank you very much, sir. Thank you very much.
Thank you, Keithana. So next question, Feni Chadwa, you can ask your question, please.
Hello, doctor. I had fever on 4th and 5th of January, but I want to take my first dose of vaccine. So when can I take now? 10 days back, I had fever.
So just wait for another 5 days, 15 days fever free, then you can take.
Okay, thank you so much.
If it was not COVID, if it was COVID, then you can delay for 1 month.
Actually, I had fever and body ache. So can I get my antibody test done and then...
Yeah, you can, to find out whether that was COVID or not, you can get an antibody test done.
So when can I get my antibody test done?
Get it done today, tomorrow, anytime.
Okay. Thank you.
Yes, Divya, please go ahead.
Hi, doctor. My question is, in cases of a common cold, can we do the betadine gargle? Is it safe?
Yes, it is safe because it is not going into your stomach and it is not going into your blood. So it is only going into your mouth and throat, and it does not get absorbed in your body. So it works locally. You can get it done safe.
Okay, because I can feel some particles might get swallowed when we try to gargle it. So,
Doesn't matter. They'll pass out through your stool or the intestine.
okay, thank you so much.
So there's a curious question, Dr. Narendra, that Bhavna is asking. What is data shows when pregnant women take vaccination for COVID?
So the data shows that when pregnant women take vaccination, they are less likely to have premature delivery. They are less likely to have any complication, even if they get fever, what we call as breakthrough infection. They are less likely to get admitted in the hospital. They're less likely to be put on oxygen or oxygen requirement, and they're very, very less likely to die of COVID. So it is a very, very supporting good data of vaccination in pregnancy. And their child will get passive immunity from the mother's blood. So the unborn baby also comes out immune if vaccination is taken.
Thank you, doctor, for that. Aruparva is asking, I have only body pain and there is no other major symptom. Is there any need to test for COVID?
No,
I'm
no,
doubly vaccinated also.
no, because this weather is causing a lot of common cold and body aches and all. So just take paracetamol, dolo tablets morning, evening for 2-3 days. If it does not vanish, then maybe you are calcium and vitamin D deficient. So take calcium and vitamin D. If it still does not vanish and other symptoms come, then go for test.
There are a lot of questions about booster dose, and I think what we got out of this session is if you have taken 2 doses, after 6 months you can take your booster dose, right, Dr. Narendra?
Yeah, but the government of India is not allowing booster dose for everyone. It is allowed only for those who are working in hospitals, healthcare workers, and those who are over 60. Less than 60 years of age, the booster dose has not yet opened. It will open up only after 3-4 months when India makes more vaccines. Right now, booster dose can be taken by people over 60 years of age, and those who are working in hospitals as nurses, compounders, hospital people, everything else, and by healthcare workers and those who have comorbidity. So those younger patients who have diabetes and other diseases, only those. So booster dose is not yet available for everyone.
Manjula, you can ask your question, please.
Yeah, thank you. Good afternoon, doctor. Thank you so much for this informative session. Right now, I'm in 23rd week of pregnancy, and till now, I haven't vaccinated yet. And 2 days back, I had my TT injection. So, how much gap is needed for this to get vaccinated, as doctor advised to get vaccinated?
So TT, see, in pregnancy, you have to get the following vaccination. Tetanus toxoid first dose, Boostrix second dose. Second dose of tetanus toxoid should be DPT, Boostrix. Tetanus, diphtheria, pertussis, it covers, and that is in the 9th month. Then you must get your hepatitis B vaccination if you're not already vaccinated for hepatitis B. And every year in September, you must get the influenza vaccine. That is the flu vaccine. Now, in between vaccination, usually 1 or 2 days is enough. But with COVID, you might get fever. So if you've taken COVID vaccination first, the next vaccination should be delayed for 1 week. Otherwise, you can take them all together also. There is no problem.
Okay, I had my first dose of TT in 4th month, sir, and then second dose I had in 6th month. So what are the injections? Okay.
So Boostrix can be taken in the 9th month. And if you're not taken your flu, the flu can be taken now. And then you can take COVID vaccination anytime.
How much gap, sir? At least 10 days?
1 week is enough.
1 week. Okay, sir. And sir, this vitamin D capsule, for how many weeks we need to take this in pregnancy?
So vitamin D comes as powder pouches or liquids as 60,000 units per week. or it comes in a bottle like this, which has a cap, and when you revert, you get the 2 ml, and this is 2000 units per day. So after 12 weeks of pregnancy, 2000 units per day throughout your pregnancy. This yellow colored liquid, it comes here, and then you just open the cap and drink it. So that is vitamin D daily dose. And some doctors will give you weekly dose. Weekly dose has to be taken for 6 weeks, then a gap of 1 month, and then repeat after 6 weeks again for 6 weeks.
Thank you, sir.
Thank you, Manjula. Divya, can you ask your question, please?
Yeah, hi.
Dalchini, adrak, black pepper, kada can be taken, but not too much. They all cause acidity. So taken only very little. They can cause burning and acidity also.
Yeah, so doctor, I wanted to check, like there are a lot of cases now, they're increasing, and I wanted to work from home, but that's not being possible. So till what extent can I go out and work? I mean, till when can I go out and work? And what are the precautions I have to take if I have to work? Because I work in media and I get to get in touch with a lot of people every day.
So you have to, when in touch with people, you have to have a very tightly, nice fitting N95 mask on, and preferably a face shield also. And keep a little distance. Of course, if you are both are not masked, you get the infection in 5 minutes of exposure. If one is masked and the other is not masked, you get it in when you are in contact for about an hour or so. But if both are masked by N95, then it takes about 3 or 4 hours. You can still get infection, but you are safe for 3 to 4 hours talking to each other. So repeatedly in between, you will of course do sanitization of your hands and repeatedly keep the small sanitizer in your pocket, a tight fitting N95 mask, which is changed every day, and preferably a face mask over it, and try to keep a little distance.
Any medicines that I have to take as a precaution?
Medicines is vitamin D, vitamin C, B complex, good diet.
Okay, thank you. And I can work, right? I can go and work for like...
We all have to work. We all have to live with this disease now. Look how we are working. Only every day touching patients, every day seeing patients. So it's an occupational hazard. This disease will remain with us forever now.
Yeah. Thanks. No.
And get yourself vaccinated.
Okay. So I'll take 3 last questions now. I know there are a lot of questions, but yes, I have a solution for all those things.
We'll answer all those questions on the WhatsApp group. You can all join that one.
Yes. Also, we will be circulating a FAQ where all the questions which are in the chat box will be answered and floated to everybody. So no need to worry. So last 3 questions I'll take. Seema, you can please ask your question. Seema, are you there? Okay, Mariam, you can please ask a question.
Hello, good afternoon, doctor. Thank you so much for this wonderful session. I have a concern of cough congestion. I was tested positive in second wave. And since then, I have developed this problem of cough congestion. Like I feel the cough in my lungs, but it does not come out without taking steam. And since few days, I'm having that sore throat and cough problem. I tested myself and I'm negative. So how can I prevent this thing for long term?
So this is a common problem which is occurring post-COVID. It is known as post-COVID disease, or it is also known as post-COVID syndrome.
Okay.
And a lot of people who had this disease in the second wave, where the chest was involved, and some areas of chest have shown fibrosis or involvement. For them, this problem will last for a very, very long time. And only slowly your body will build up immunity. And so keep on taking steam inhalation, keep on doing breathing exercise, Lom Vilom and Kapalbhati and all that. Follow all the yoga breathing exercise, which are very, very essential to expand your lungs. Take deep breath, hold your breath, leave it, hold your breath with one nostril, hold your breath with the other nostril. Do all the breathing exercise and improve your lung capacity. Blow a lot of balloons. Now we have medicated balloons also. So you can blow a lot of balloons also to improve your chest.
I think that answers Mariam's questions.
Okay, thank you so much, doctor.
Okay. So, Ritu Parma, can you please ask a question?
Yeah, hi, sir. Good afternoon. Firstly, actually, I had been detected positive in May, the second wave or whatever. Yeah. So after that, I was badly affected, as in I had to take steroids and antiviral, but I was not admitted. My oxygen level was okay, so I got treated at home. 2 months after that, I conceived, I got pregnant. So because of that, I could not take my vaccine, because we were told that if you are positive, then after 3 months only we can take the first dose. Then I conceived, so I was told by my doctor that after the first trimester only I can get my first vaccination. So I took my first vaccination in October end, and the second dose 1 month after that, so by actually in December 1st. So now again I am positive, like in January. So why is this like immunity? Actually, I don't catch cold so often normally. Now after my second vaccination, second dose, immediately the next day I got cold, and that cold persisted for 15 days. So then again after 20 days I'm having cold and sore throat, and I tested, I got positive. So even after taking the vaccination, within 1 month we are catching it up so soon. So is the vaccine working well or not? And this thing is there. Secondly, I wanted to ask, how do I know currently that the positive I am, is it Omicron or Delta? Because the labs are saying if you have a CT value of less than 12, then only government will send it for genotype. Either that, or if you have a travel history. I don't have either of them. So I don't know which variant is this.
So why do you want to know the variant? It is Omicron. These days,
it's just
80%
yeah.
cases of Omicron. It is a genetic test, and it is a very expensive test. No private lab is doing it. The government is just doing it to find out what percentage of people are getting affected by Omicron. Omicron gives you mild infection, but it is very contagious. So even those who are vaccinated, and see, your vaccine develops immunity inside your blood. The vaccine does not give immunity in the nose or throat. And this virus is coming through nose and throat. So it will stick to your nose and cause you nasal congestion and throat. And then your immunity is in the throat. So it will not go below the throat. So you will not get chest infection. That is what the vaccine is going to prevent. Vaccine is going to prevent you will not be hospitalized. Vaccine is going to prevent your baby will be safe. Vaccine is going to prevent that you're not going to die of this disease. So that is what current vaccines do. They will not prevent infection. I myself have been vaccinated. We were the first in India to be vaccinated, but still I've got it twice because I'm seeing patients every day. But then I'm talking to you, I'm doing everything except for a little bit of nasal congestion, nothing else is there. So you don't worry. This infection, as I told you, will keep on coming every year. And probably we'll have a vaccine every year, which we'll have to take in the future. And as soon as I told you, the nose vaccine comes. The nose vaccine will come in India first. Within 6 months. That nose vaccine we will all take, and that will prevent no infection happening. So we are waiting for that.
Okay, just she sneezed and little nosy and she got positive. When I tested, she got positive and I got positive. I'm at home. I'm like sick. I mean, taking all precautions, and still we're getting this thing. So that is only concern.
This is happening to everyone. Yaar.
Yeah. Okay. Thank you so much.
Learn to live with it.
Yeah. Sure.
Thank you, Rituparna.
Thank you so much.
Okay, I'll take the last question from Jyoti now. And meanwhile, if you have still not helped us with your valuable review, I'm again sharing a link. Please help us with a review. Leave a review for us. That will be very, very much helpful. Yeah, Jyoti, you can please come up with a question.
Yeah, doctor, actually I had my second dose in June and I'm eligible for booster. Anyway, I'll not get now. But whenever I'll get, so do we need to stop any pregnancy medicine like Ecosprin or something?
No, Ecosprin is very good because Ecosprin prevents clotting, and sometimes it is seen that COVID disease and even vaccination cause a lot of. So Ecosprin should not be stopped. Iron, calcium, ecospin, vitamin D, zinc, all to be continued. Protein powder. Nothing to be stopped.
Yeah, okay. Thank you, doctor.
Thank you so much. And I think still a lot of questions are left to be answered. I can
know,
understand.
I can see. I think we can do a booster session next Sunday or something like that. Like the
Yes,
booster dose.
for sure.
But we will, most of the questions are the same. I think I've answered all of them. I've had a look at the chat box.
Yeah.
But if you're still anxious, the WhatsApp group Yukti will give you. You join there and ask there, and we will answer all that. Because there are some general questions like iron supplements, stretch marks. We are answering all that regularly, but we will do that again in the WhatsApp group. So you can join all of them.
Yes,
thank you very much for attending this. Thank you, iMoms, for giving me an opportunity again to talk to you. Last week, we talked about the labor room, going into the labor room. Today, we have talked about the COVID. So I would love to be a part of this wonderful pregnancy group and try to help as many and all of you to sail through pregnancy and enjoy it. We are your pregnancy companions.
Thank you so much, Dr. Narendra, for taking our time, your valuable time, and coming up for the session today. Thank you so much.